If you are over 60 and you are taking amlodipine, losartan, or lisinopril for your blood pressure, please stop what you are doing and watch this video right now. Because what I am about to share with you is something that most doctors simply do not have time to explain during a 10-minute appointment. And this missing information? It could be the reason your blood pressure medication is not working as well as it should. Or worse, it could be quietly damaging your kidneys, your heart, or your brain right now, and you would have absolutely no idea. I am Dr. Emily Walker, and in the next few minutes, I am going to walk you through what every senior needs to know about these 3 medications before it is too late. Here is a number that should get your attention. According to the Centers for Disease Control and Prevention, nearly 70% of adults over the age of 65 in the United States have high blood pressure. An elderly person sitting at a kitchen table in the morning, taking pills from a weekly pill organizer. 3 medication bottles labeled Amlodipine, Losartan, and Lisinopril are visible on the table. A glass of water is nearby. Soft morning light. Close up on the hands picking up the pill. That means the majority of seniors watching this right now are either already on one of these medications, Amlodipine, Losartan, or Lisinopril, or a doctor has recommended they start. These are among the most prescribed drugs on the planet. And yet, blood pressure remains uncontrolled in a shocking number of patients who are taking them faithfully every single day. So the question I want to answer today is, why? What is going wrong? Let me start by breaking down how each of these medications actually works inside your body, because understanding this changes everything. Amlodipine belongs to a class of drugs called calcium channel blockers. Think of your blood vessels like a garden hose. When calcium rushes into the muscle cells surrounding that hose, the hose gets tight and narrow, and the pressure inside shoots up. Amlodipine essentially blocks the door that lets calcium in. The muscles relax, the hose widens, and the pressure drops. Simple enough. Close-up shot of a doctor wrapping a blood pressure cuff around an elderly patient's arm. The BP monitor screen shows numbers dropping. Or use a simple animation of a narrow blood vessel slowly relaxing and widening as blood flows through more easily. The visual should match the garden hose analogy being described. Lisinopril works through a completely different pathway. Your body produces a chemical called angiotensin II, and this chemical is like a signal that tells your blood vessels to squeeze tight. Lisinopril blocks the enzyme that makes angiotensin II in the first place. No angiotensin II, no squeezing, lower blood pressure. This drug also has a very important protective effect on your kidneys, which is why doctors love prescribing it to patients with diabetes or early kidney disease. Then there is Losartan, which also targets angiotensin II, but instead of blocking its production, it blocks the receptor where angiotensin II lands. Think of it like changing the lock on the door so the key cannot get in. Both Lisinopril and Losartan work on the same system, which is why doctors will almost never prescribe them together. And here is the first surprise many seniors do not know. Taking both of them at the same time does not double the protection. Research published in the New England Journal of Medicine actually showed it significantly increases the risk of dangerous kidney failure and high potassium levels, a condition called hyperkalemia that can stop your heart. Now here is where things get really important for anyone over 60. As we age, our bodies handle these medications very differently than they did when we were younger. And this is something your doctor may not fully account for. First, consider blood pressure itself. When you are older, the walls of your arteries become stiffer, a natural result of aging. This means something called isolated systolic hypertension, where your top number is high, but your bottom number is actually too low. If your doctor is only treating your top number aggressively, your bottom number, the diastolic pressure, can fall dangerously low. And research shows that when diastolic pressure drops below 60 in older adults, the risk of a heart attack actually goes up, not down. This is called the J-curve phenomenon, and it is one of the most underappreciated dangers in senior blood pressure management. Second, and this one surprises people every time I mention it, amlodipine can cause a significant drop in blood pressure when you stand up quickly. This is called orthostatic hypotension. In younger patients, the body compensates almost instantly. But in seniors, that compensation is slower, so you stand up from your chair, your blood pressure drops for a few seconds, and suddenly you feel dizzy or lightheaded. An elderly man slowly rising from a chair or the edge of his bed, reaching out to grab the armrest or wall for support. His face shows mild dizziness or discomfort. slightly slow motion. The scene should feel familiar and real, not overdramatic, just honest and relatable to any senior viewer. That lightheadedness is not a minor inconvenience. In seniors, it is a major cause of falls. And falls, as we know, can be catastrophic. Hip fractures, head injuries, and in many cases, a dramatic decline in overall health. A 2019 study in the journal Hypertension found that orthostatic hypotension was present in up to 30% of older adults taking antihypertensive medications. 30%. That is a number we should not ignore. Now, I want to talk about your kidneys, because this is where many seniors get into serious trouble without realizing it. Lisinopril and Losartan are both often prescribed specifically because they protect kidney function. And they do, in the right patient. But here is what many people are not told. When you first start Lisinopril or Losartan, your creatinine level, a marker of how well your kidneys are filtering, often rises slightly. This is actually expected and usually not a problem. However, in seniors who are even slightly dehydrated or who are taking anti-inflammatory pain medications like ibuprofen or naproxen, that rise in creatinine can become dangerous. An elderly person standing in a pharmacy aisle or at home, casually picking up a bottle of ibuprofen or Advil from a shelf. They look completely unbothered, treating it like a harmless everyday item. Cut to a close-up of their blood pressure medication sitting on the kitchen counter nearby. The contrast between the two tells the story without a single word. NSAIDs, those common over-the-counter pain medications, interact with both Lisinopril and Losartan in a way that dramatically reduces blood flow to the kidneys. Thousands of seniors end up in the emergency room every year with acute kidney injury from this exact combination, and many of them had no idea it could happen. There is another silent danger hiding in this medication group, and it has to do with potassium. Lisinopril and Losartan both raise potassium levels in the blood. Normally, this is not a problem, but many seniors also take potassium supplements or eat large amounts of potassium-rich foods like bananas, oranges, and leafy greens, thinking it is heart-healthy. And it is, in the right amounts. But combined with these medications, potassium can quietly build up to dangerous levels. High potassium, or hyperkalemia, affects the electrical system of your heart. You might feel muscle weakness, fatigue, or nothing at all, right up until your heart rhythm becomes life-threatening. The terrifying part? A large number of people with dangerous potassium levels feel perfectly fine until a serious cardiac event occurs. A landmark study called the SPRINT trial, published in the New England Journal of Medicine in 2015, changed how cardiologists think about blood pressure targets in older adults. The study found that targeting a systolic blood pressure below 120 significantly reduced cardiovascular events. But it also revealed something important. More aggressive treatment led to higher rates of kidney injury, dangerous drops in blood pressure, and fainting in older patients. This is the tension your doctor is navigating every time they write your prescription. And this is exactly why being an informed patient, understanding what your medication does, what signs to watch for, and what to avoid, is not just helpful, it is genuinely life-saving. So what can you actually do with this information? First, if you are taking any of these 3 medications, make sure your doctor is checking your kidney function and your potassium levels regularly, at least once a year, and ideally every 6 months if your levels have ever been borderline. Second, be extremely cautious with over-the-counter pain relievers. If you are on Lisinopril or Losartan and you need something for pain, talk to your doctor about alternatives that are safer for your kidneys. Third, when you stand up from a lying or seated position, do it slowly. Sit on the edge of your bed for a moment before you stand. This simple habit could prevent a devastating fall. Fourth, if you ever feel your heart racing, notice unusual muscle weakness, or feel persistently dizzy, do not dismiss it. These can be signs that your potassium or your blood pressure is moving in a dangerous direction. And fifth, never stop these medications on your own. Stopping Lisinopril or Losartan or Amlodipine abruptly can cause a sudden, dangerous spike in blood pressure called rebound hypertension. Any changes to your medication must happen under medical supervision. Here is what I want you to take away from this today. These medications, Amlodipine, Losartan, and Lisinopril, are genuinely effective tools that have saved millions of lives. I am not here to scare you away from them. I am here to make sure you are using them safely, wisely, and with the knowledge that protects you from the hidden risks that come with them. Because the difference between a medication that saves your life and one that quietly harms you often comes down to one thing: information. And now you have it. A warm, natural scene of an elderly patient sitting across from a doctor in a bright clinic room. The doctor is leaning forward, explaining something with care and patience. The patient is nodding, looking relieved and confident. Slowly fade into a wide outdoor shot of an elderly couple walking together in morning sunlight, smiling, calm, and healthy. End on a still close-up of a blood pressure monitor showing a perfect reading. If this video helped you understand your blood pressure medication better, please take a second right now and hit that like button. It genuinely helps this channel reach more people who need this information. And if you want to stay informed with clear, honest, science-based health advice every week, subscribe to this channel and make sure you tap the bell so you never miss a video. Coming up next, I am going to explain why so many seniors on blood pressure medications are still having strokes, and the one overlooked risk factor that almost nobody talks about. You will not want to miss that one. I will see you in the next video.